On this week's Tuesday Talk, we are talking about a very requested subject.
Yes, it has to do with our health.
Healthcare on the road. I just stopped working, or will be, a week away, working full time. And so we're coming off of normal healthcare that was provided by my job. And we had to figure out what we were going to do now that we weren't working and that we were traveling.
Yes.
Just a little bit of background, because this is going to be different for everybody. So some background on us that will help you understand the path we took to what we decided. One, we're both decently young. I mean, we're in our early mid-30s. We're both in good health.
Yes, we are.
The only pre-existing condition that either one of us possess is me, and I get migraines, though I've been trying to treat them naturally for a while now, and I'm hoping that'll get better once we hit the road and I can spend more time on it. But that's the only pre-existing condition. We take no other medication.
Yep, young, active, don't smoke, drinks occasionally,
Yeah.
a normal amount.
Yeah.
And there's really nothing extenuating about our circumstances aside from our migraines.
Yes.
So
We don't
it's a more simple circumstance,
Yes.
I think.
We very seldom go
From
to the doctor.
from that perspective.
For the past years that we've been living together, we very seldom go to the doctor besides just normal checkups.
Yeah.
We don't get sick all that often. So in general, we try to lead healthy lives through exercise and eating well and getting enough sleep and all of the natural things you can do. But obviously we do need health care. One, because it's mandatory here in the States. And two, because something could happen. One of us could get very ill. We could fall and hurt ourselves. Who knows what could happen?
You never know.
The other thing that you need to realize is that we have decided to keep Arizona as our residency state, or a domicile state, that's the right way to put it, when we travel, because my family's here. We may change that in the future, but that means we were limited to looking at Arizona-based healthcare.
If we were going to do the traditional,
Yes.
on the marketplace, the exchange.
Which we looked.
We did, and through subsidies, because our income was going to be low enough, with subsidies, we were looking decently okay from a cost and coverage perspective.
No, not coverage.
With one exception. When we're out of the state, that's where we have problems. While we will have a permanent address here in Arizona, we very rarely will actually be here in Arizona. So what do we do when we're out of state?
Yeah.
That was our problem. So
a lot of the plans, almost all the plans on the Arizona
it got real
healthcare,
expensive.
Marketplace do not cover out-of-state normal doctor's visits. They will cover if you go to the ER, but as soon as they transfer you from an emergency room to a normal hospital room, it is no longer covered. And so that was a very big deal for us, because if something were to happen and we needed to make follow-up visits or whatever, we didn't want to come all the way back to Arizona to do that.
And one thing we don't want to do is treat the ER like our primary care physician.
No.
Because a lot of people do that now, and that's why
The
ERs
wait times are so
are
rough.
quite heavy.
Yeah.
So that's something we definitely did not want to do, but we also didn't want to pay an arm and a leg to get coverage everywhere.
Especially since we're kind of looking at this as emergency coverage. Since we are so healthy, it is not something that paying an arm and a leg for would really benefit us most of the time.
That's right.
So we decided to go with...
Well, we asked around to other RVers. And
because the RVing thing, most states do not have coverage outside of the state now. That's becoming more and more common. So we knew there had to be another option for other young RVers who are doing this.
Yeah, we're certainly not the only ones who travel full time. A lot of those people have jobs, so they have health care through their jobs. But if they don't, there's a very, very common theme amongst full-time RVers. They don't do health care. They do health share.
Health sharing ministries. So we're not going to get super deep into what they are, but in general, they are organizations with a religious background.
They're usually nonprofits, religious-based, or if they're not all that religious, they
hold religious tenets.
encourage you to live in such a way where you probably won't need expensive procedures all that often,
Yeah.
even though they could happen.
They require certain health in order to get in, and they require
Yes.
you maintain that health. They also will not cover things that are due to your own choices that they do not agree with. Such as if you hurt yourself doing something dangerous,
Something
like
stupid or
skydiving,
dangerous,
they
yeah.
may not cover it. And in general, we like the principle of sharing so you're pretty much sharing money with other people in this community to help with health care costs. There's like a normal out of pocket, like you would with a normal health insurance, amount out of pocket that you pay, but otherwise you submit your bills to the health sharing ministry, and as long as they approve of them, you get them paid for by other members, pretty much by their shared money.
We signed up with Liberty Health Share, and I have a more in-depth article about this on our sister site, thinksaveretire.com, and we will link to that below in the comments if you care to read more about it. But the more high-level spiel here is we have the best plan, which is also the most expensive plan, through Liberty Health Share. We pay $299 a month starting
for us combined.
in April. For us combined, yes, exactly, for both of us, and that covers all qualifying medical expenses up to $1 million.
After we pay
$1,000 deductible.
deductible out of pocket maximum type thing.
And we can. There's no in-network. You go to any doctor you want, regardless
anywhere
of where
in the
you
States.
are.
So in fact, they sometimes cover out of the U.S.
For travelers, it makes it just dirt simple and relatively affordable too.
Yeah. So that is what we decided on, and we will let you know how that goes. We've heard good reviews from some of the fellow RVers that
especially
have it.
with Liberty, because they are one of the less religious.
They are religious. You can't say they're not religious.
I didn't say that. I said they are less. They're less strict with what you can and can't do and can't believe. We don't necessarily want to be required to believe what this organization believes, but it's relatively acceptable.
We're okay with Liberty. Some of the others we would.
For example, if you're a smoker, they probably won't accept you.
Unless they do have what I've heard, they do have a plan where you can actually work with one of their counselors towards eliminating your smoking, and if you do that, they may accept you.
Okay, there you go. That's something.
One thing we didn't mention, we talked about pre-existing conditions for a reason. They do not cover any pre-existing medical costs due to pre-existing conditions for the first year.
Yeah.
After that, they cover a percentage of that cost. I think it's like 25% and then 50%. And after 4 years, they'll cover the full cost of whatever that pre-existing condition it would be. So someone who's coming in with any kind of pre-existing condition, this is probably not the best thing for you.
I guess they don't want you hopping on and immediately submitting a bunch of bills,
yeah.
Which it might suck for you if you need them, but for everybody else, it really makes the costs relatively affordable that way.
And so that's what we decided on.
We're going to try it and see how it works.
Yeah. And we might let you know in the future if there's anything to let you know about.
Sure thing.
So that's it for this week. If you have any more questions for a future Tuesday talk, please leave them in the comments down below.
Mm-hmm.
And as always, if you like these kinds of things, if you could give us press the like button, give us a thumbs up.
We leave in like 4 days.
We do. We leave really soon.
Yeah.
Yay.
I had to throw that in.
Yeah. Okay. See you later, guys.
Yep.
Bye.
Bye.